Let's move on to quiet versus forced breathing. So quiet breathing, or eupnea is the medical term for that, but I'm probably referred to as quiet breathing. So quiet breathing does not require conscious thought. So do you need to think about every single breath you take? Not really, right? So again, if you're just doing whatever you're doing without really thinking about your breathing, that's quiet breathing. So it mostly involves that diaphragm. So again, the diaphragm, that flat sheet of muscle that's right below your lungs that helps to inflate and deflate it as well. So the diaphragm is mostly the big driver behind quiet breathing. And again, do you really need to think about it? Not really. Then you have something called forced breathing. So voluntary hyperpnea. So it is different. Some texts, I did see some online researchers saying that forced breathing is equal to hyperpnea, but that's not quite true. Hyperpnea just refers to an increase in your breathing, whether it's volume or your breathing rate, and it can be something that's due to some sort of condition or disease that you have. So this is what we're talking about when you breathe deeper or you breathe faster on purpose. So this is when you use conscious effort. That's the big difference between quiet breathing and forced breathing. You don't really think about quiet breathing. This is subconscious. Whereas forced breathing, this is using conscious effort. So this uses more muscles as well. So this is when you're taking a big deep breath and breathing it all out as well. So do I want you to memorize these lists of accessory and primary muscles? Not really, because why? Well, depending on the textbook, depending on the resource, there's different lists of these accessory and primary muscles. Actually, primary muscles are pretty consistent, but accessory respiratory muscles, yeah, there's many lists that differ in which muscles are involved in respiration. But why do I talk about primary and secondary or accessory? So your primary respiratory muscles, these are the ones that operate without you really thinking of them. So these are the ones that help you with quiet breathing. So here we have the external intercostals. Again, costal, that anatomical term if you're here last semester, referring to the ribs. So these are the muscles between the ribs, but they're external. We'll get to the internal in a bit. And that diaphragm, again, sitting right below your lungs. So again, when the diaphragm contracts, remember, whenever a muscle contracts, it always shortens, right? So the diaphragm, when it's relaxed, is more like a dome, but when it contracts, it flattens out. So when it also relaxes, it goes back to its original shape and pushes your lungs. And by pushing your lungs, increases the pressure in your lungs and forces you to breathe, or actually causes you to breathe out. So accessory respiratory muscles, these are muscles you recruit, and these are the ones that actually need conscious efforts. These are skeletal muscles that help you with forced breathing and breathe in more than you do during quiet breathing. So during, what do you see here? Well, inhalation always requires muscles. And why is that? Well, again, your rib cage, that's the big driver behind your breathing and your lung volume as well. So to lift something, well, remember, gravity is always pulling your rib cage downwards, right? So in order to lift your rib cage, you need to lift against gravity as well. So if you're lifting against gravity, well, what happens? So you always need to use some sort of energy to do some work against gravity. So inhalation is an active process requiring energy. Why? Because it requires muscles to lift your rib cage against the pull of gravity. Now, quiet inhalation only uses primary respiratory muscles, so these can operate by themselves. So here we have the diaphragm and the external intercostals, and usually these are pretty consistent in terms of what are the primary respiratory muscles behind quiet inhalation. So here we have primary respiratory muscles. And then external intercostals. So again, what do we have here? Why do I show this image? So external intercostals, well, look how they're oriented. And if you were here last semesters and remember the whole thing about origins and insertions, so remember, insertions always pull toward the origin. So what happens here? For the external intercostals, what we have here is that they're pulling the lower rib up toward the origin. But not only are they pulling it upwards and lifting your rib cage, they're actually pulling it a little toward the side. So what's happening is that you're not only lifting your rib cage, you're also lifting and expanding your rib cage. So this is why this diagonal slant is very important for the external intercostals. So again, they lift up not only upwards, but they lift upwards and out. Alright, so during inhalation, again, it's all about increasing that volume, right? So increasing that volume. So increased volume decreases the pressure. Again, that's Boyle's law. So now the pressure in the environment is greater than the pressure inside your lungs, aka your intrapulmonary pressure. So what happens? You have air moving into your lungs. Now with forced breathing, what happens? Well, now instead of just using your primary respiratory muscles, you're recruiting more muscles. So more muscles, more force, more work. So forced inhalation uses more muscles to lift your ribcage even more, expand your lungs even more, drop the pressure inside your lungs even more, and fill your lungs with more air. So during exhalation, so what happens during exhalation? Well, it's increasing your intrapulmonary pressure. So why? You want to have the pressure inside your lungs greater than the pressure outside of your lungs. So air goes from inside your lungs out toward the environment. So again, all about the high to low pressure. Again, that's going to carry you a lot through hemodynamics, through respiration, and maybe a little through the next exam as well. So quiet exhalation. So quiet exhalation, this is the one you don't really have to think about. And why is it a passive process? Well, the funny thing is, like, do you really need additional muscles for your, or like, say, well, what can I drop here? Like, take anything in your, like here we have my notepad. Do I need energy for it to drop it? I don't know, not really, right? For it to go down toward the floor, all I need to do is let go and it drops. Same with your rib cage. You don't need additional muscles to help drop your rib cage during quiet exhalation. So all you do is relax your muscles that help with quiet inhalation, and then your rib cage flattens on its own, thereby increasing the pressure inside your lungs, allowing you to expel the air from inside your lungs toward the outside. So it's all due to that pressure difference, due to changing in volume. You just relax those primary respiratory muscles, and there's no muscle contraction. So again, all of these, your rib cage can collapse by itself if you're upright and just relaxing. So by relaxing your rib cage, collapsing your lungs, increasing the pressure inside your lungs, you breathe out without additional energy. Now forced breathing, now instead of just allowing yourself to relax, you're going to be using additional muscles. So notice that there's a pattern. During forced inhalation and forced exhalation, you're always using more muscles than usual. So these uses so forced exhalation, forced inhalation, they not only use your primary respiratory muscles, they use your accessory respiratory muscles. And what do you notice with the direction of the accessory respiratory muscles? Well, notice that instead of pulling upwards like they do during inhalation, they're pulling downwards. And they're also pulling this ribcage flatter. So again, so don't worry too much about, or if you're taking the open-ended questions, yeah, maybe you'll have to refer to this. But in terms of if you're taking the multiple choice that's proctored, don't worry too much about these. These are more for FYI. So, and remember my rules from if you were here last semester. If you remember my rules about the muscular system, remember for every muscle that does an action, there's another muscle that undoes an action. So remember the external intercostals, they lift up and outwards. So again, due to their direction, but the internal intercostals here, notice that their origin and insertions are flip-flopped. So instead of pulling up and out, they're actually pulling down and flattening your rib cage. By flattening your rib cage, you decrease the volume. By decreasing the volume of your rib cage, you increase the pressure inside your lungs. That forces air out. So again, during exhalation, what do you have? Decreased lung volume, resulting in increased pressure. Again, Boyle's law. This forces air outwards.